Hi, I'm Karen Davis, the Chief Nursing Executive for the University of Rochester Medical Center. Today, I'm here with Kathy Rideout, the Dean for the School of Nursing, and we're here to talk about the Year of the Nurse, how it transpired, and really close it out for you and talk about some of the things that really we remember as highlights from the year and also things that we didn't expect.
So, thank you for joining us. And Karen and I, over a year ago, we're really planning everything that we were going to do this in the year of 2020. And even starting off almost the January 3rd, I think it was, where we were welcoming everyone coming into the hospital and into the School of Nursing with pins celebrating the Year of the Nurse. Little did we think what the year would actually transpire to be. And so, Karen, what are some memories that you have?
Right.
Of this past year and maybe things that you've learned?
Yeah. Some of my memories of the beginning of the year were really a lot of, celebratory anticipation of what this year would mean. We had kicked it off with a lot of different videos, including the region and the leadership there. And we, really intended to highlight what our whole health system is doing in terms of celebrating nurses and the specialties and the unique skills that we bring to patient care. And then the pandemic hit. And when I look back on this year, I think that, it was almost really appropriate that we named it the Year of the Nurse. And then the nurses really were at the forefront of this pandemic and how we were able to really show the public and the world, what nurses do and how we contribute and how resilient we are and how flexible we can be. And I think my thinking of the year is that it was really my proudest moment when I watched the nursing staff and all the things we asked them to do and how they just rose to the occasion. And I'm really glad that I got to do a pandemic in my career, because I think when I look back on my career, I think this will be a time that I cherish as really thinking about how proud I am to be a nurse, but how proud I am to work with the nurses that work in our health system.
And I do remember that in January of 2020, we welcomed a whole new class of nursing students. And so, it was this celebration that they are starting their journey as a nurse in the first month of the Year of the Nurse. So there was all that excitement, and their excitement just built, as they, started to learn more about what nurses are, what nurses do, and then really, see how they were affected. And, the part that I was so proud of is, in addition to our faculty just stepping up and really having to transform how we provided education, in the initial month of the pandemic, because everything had shut down, our students weren't able to be in the clinical areas. They weren't even able to be in the school. We had to shut down, things in the school as well. But to have students emailing me saying, let us out there. This is what we signed up for. I want to be on the front line. This is what my dream has been. And to really see their enthusiasm of, wanting to make a difference, even in the light of everything that was going on. We didn't know how dangerous everything was, so they really were willing to put their lives out there because this is what they wanted to do and this is who they wanted to be. And I think really seeing that all come together and knowing that we had a partnership, with the nurses here in the hospital and with Karen and I, knowing that we'd figure it out. And I think it was never a case of we're not going to be able to do this. It was a case of how we're going to do this and knowing that we would be able to work together to do it that way.
And that makes me think about our partnership, Kathy, with the faculty and our clinical staff. And I can remember early on in the pandemic, we were thinking about how are we going to have the resources that we need, who can help us. And we were thinking about asking the retirees to come back into the organization, whether as helping hands or to, take an assignment. And immediately the school faculty reached out and said, how can we help? Can we help with a course to put together a reentry course? And literally in a week, I think that was put together. And I just was, I was so grateful to have a school of nursing right across the street with so many resources that were just standing by ready to say, tell us how we can help. And I think about our nursing students who came out of school in a pandemic. This is the only way they've ever known how to work is this way. And I think, wow, those are real risk takers and trailblazers because they weren't afraid and they entered a workforce that was chaotic and discombobulated, and they didn't get the same kind of training that the people before them did, and they've done great. And I think that just shows the type of students that we have at the school.
When I think about resilience and I think about being all in, they were all in, as well as our faculty and staff. And I think, we had some staff that actually learned to some students that were struggling financially, and actually took food out of their own freezer and delivered it to the students because they were, afraid to go in grocery stores. They didn't really know how to do that. And really just seeing people just rising to the occasion that, I never doubted that they would do that, but just to see it come to fruition was really, really very important to us. And I think that when I think back about, the only other situation I think we've ever been in that had any similarities was when HIV came on the scene. And, the things that we do differently now because of living through HIV, the initial phases of HIV, like wearing gloves. We never wore gloves. Universal precautions were never part of our care. And I think about, what are some things that are going to stay with us as healthcare providers?
Mm-hmm.
What are we going to do differently going forward because of what we've learned here?
Yeah, I think there's a lot of things that we tried that we wouldn't probably have ever tried unless we had to, like a lot of the team nursing and stretch assignments that we did. And, we asked people to float outside of their normal work areas because we needed them in other areas. So, for example, we asked the peds nurses to go to adults. We asked the ED nurses to work in psych. We stretched people into places that in normal times they would have looked at us like, what, are you crazy? I'm not going to go work there. I don't know how to do that. But we asked them to do it, and they did it, and we supported them. And there was a ton of teamwork that happened. And I think what we learned from that is that we can be ultra flexible. Would we want to do it all the time? No, but when we need to do it, here's how we do it. And that's again why, as we learned that first time, we sort of during the summer put together a playbook, I call it, of if we have to do this again, what will we do differently? What will we not do? And so the second time around, I think we've been able to really put those principles into play and have had much better outcomes, I think, in how we've asked people to work in different environments and what kind of training and support do they need to do that. Where we can gain efficiencies in those ways will help us just be able to have funding and resources for other areas, and that will expand our innovation and creativity.
In June, when students returned to the clinical area, I had some students that said, I'm worried that the nurses have gotten used to not having students and they're probably so busy and they're so exhausted. Do you think they're even going to want us there? And, I knew from my experience, absolutely. But of course there was that worry. They are exhausted. They have been stretched to the limit. And almost instantaneously, when the students were back on the units, they came back and said they welcomed us with open arms. They had missed us. They had missed us being part of the team, and it could not have been a better experience, because they're all trying to figure it out. And I said, because the students are part of a team, they're welcomed here. This is a teaching environment. This is what an academic health center does. And it was an easy transition for them to get back into the clinical area.
The other thing I'm thinking about that the pandemic showed us is how we work as a system. Yeah. I relied on the affiliates, and the affiliates really, I think, benefited from being a part of our system. So as a system, we were able to work together and say, how do we make sure that everybody has what they need? And I think because we had that system structure in place, we were able to get the supplies that we needed. We were able to get the resources. We relied on each other to swap ideas. We would have a call, in the beginning it was like weekly, saying, how are you working with your staff? How are you floating people? What are you doing to incentivize them? How are you supporting them? And we really, the CNOs across the system, I think, really engaged with one another. And that was another sort of example of, I'm glad we had that structure in place before the pandemic hit, because we could rely on that. I was worried in the beginning, would the pandemic scare people off from wanting to be nurses? And would it take a toll on us? Because, we need a workforce, and you are a provider of that. And what we saw was people continue to want to go into nursing, which I'm so relieved that, in fact, I think it's more
Right.
people are wanting
Actually,
to be
I
nurses.
was worried about that as the dean, was saying, this pendulum could swing either way. It could swing to the side that there is no way I would ever want to be a nurse and be faced with these kind of situations, or it could swing the opposite way, that either this is a profession I want to be in, or I want to advance my education as a nurse. And we absolutely saw that pendulum swing this way. And we have more students now than we've ever had. We reached a record enrollment for this year, and I think that says something about the profession.
It was a wake-up call, and it was a demonstration to people that this is a way that you can make an impact. And and I think more than ever, news coverage, stories, whatever it was like free advertising for us, because we were doing this all anyway, all along. But then the pandemic sort of really put us in the spotlight, which I'm grateful for, because we need nurses and we need people to understand what we do. And I think the community response to the pandemic was also one of my proudest moments, to be a newcomer to Rochester relatively, and then to watch what the community did to support us in the pandemic. I was like, wow, that is impressive. The outpouring of cards, letters, signs in our front, lawns, food donations, just, every day I would come into my office and somebody would have dropped off hand lotion or something for the nurses. And I was like, this is an amazing community that really appreciates what we do.
Or they were making masks.
Yeah.
So there was, groups of individuals, community, whether it was the Girl Scouts, whether it was other school groups, community making masks, so that they could protect our healthcare workers. As we look ahead to 2021 that we're knee deep in already, I think there was this sense of security that 2020 will be over and everything will be fine in 2021. And so we know that's not the case. We know we're still in this for a while. But we're looking ahead to, how can we, continue to support nurses and other healthcare workers, as we continue to really continue the course, until we are able to have the herd immunity, feel there's a safety in order for us to to continue to celebrate. And so Karen and I are committed that we are still going to celebrate and have an ending celebration of the Year of the Nurse. And our plan is next November, hoping that we would be able to have something in person where we can bring together all those who have worked so hard to be able to really have a celebration of the Year of the Nurse. We had planned it for last November. We had planned last November 2020, that we would have the end of the year to celebrate, but obviously that couldn't happen. And so our plan is to do something the end of 2021 and to be able to celebrate in person again.
I'm looking forward to that. And, I think gathering and being able to be together will be just a perfect way to celebrate everything that people have done during this time. And, I know that we'll have the support of the community as well as we do that. I think, it'll be even more special, I think, because people, I think, want a way to recognize what we've, been able to achieve, as an organization and as a community.
And I think just to really to publicly, thank Karen for me to have a partner that I'd come over to see patients and I would stop by her office, just to see someone in person, but to really know that we had this partnership, and it truly is a partnership. That if we were struggling as a school, or she knew if they were struggling with something here, that together we were going to make it work. And I don't want to sound too Pollyannish, but I think sometimes we take that for granted, that we do have this partnership that we can really tackle anything. And I think this again just solidified that.
Well, I appreciate that, and you said it beautifully, that it was sometimes that partnership that got us through, and knowing that I could rely on my academic colleagues, and even through all of this, we didn't stop doing evidence-based work. We didn't stop doing research. People have continued to do that, and I think it's because they know that the support is right across the street. And we had people in DNP programs and master's programs, and they kept going.
On.
Nobody took a pause, and they used the work in their program to augment what they were doing in the clinical area. And that was another great example of that clinical partnership. Is that we were able to just keep that going, and I think it strengthened what we were doing.
I do too.
So I appreciate you.
Thank you.